Hi friends, myths and misconceptions about allergies and allergic rhinitis. That's what the topic is for today. Commonly people have a lot of misunderstanding about allergies, and that's what I, Dr. Sitesh Roy, your super specialist in allergy, asthma and immunology, is going to talk about today in this special video. Friends, allergic rhinitis or nasal allergies is a very common condition. It affects almost 20% of the Indian population, right from sometimes infancy all the way to very senior citizens. It's a very common problem. It's increasing day by day, and there are multiple factors causing it. So having myths and misconceptions busted is a very useful thing when it comes to this condition. So one of the first misconceptions is that it's just a cold. It's a seasonal problem. Okay. Now a simple cold like a viral cold would have fever, cold, cough, maybe sneezing, runny nose, watery eyes, red eyes, but these usually last for 5-7 days, max 10 days. A person gets better after that and they're fine. Whereas in allergic rhinitis or allergic rhinosinusitis or allergic rhinoconjunctivitis, a person can have symptoms for weeks, months, and even years, depending on whether it's a seasonal allergen like a pollen or a year-round allergen like house dust mite, mold, cockroach, or any of those indoor pet allergens that a person can have. And the reason why this is not just a simple cold is because with this a person can have their sleep affected, their play affected, their work affected, their study affected, and this really has a very big impact on a human being, especially when they have chronic allergies. The next myth that is commonly there is that allergy testing done by the skin test method, which is the oldest method, has now become obsolete and you only can test it through a blood test. This is not true. Even now, the American Academy of Allergy, Asthma, Immunology, the European Academy of Allergy, Asthma, Immunology, and all the major societies around the world agree that allergy skin testing is the most clinically relevant method of testing for allergic rhinitis or any of the allergic diseases for that matter, for most of them. And while blood tests have certain advantages, while blood tests have certain advancements that have been done, such as component resolved diagnostics, still when you look at the first line of treatment and the most what I would call clinically relevant method, it is still allergy skin testing. So that's your second myth. The third myth that I shall talk about, because this is something that I hear very commonly in my clinic, is doctor, though I have tested positive to house dust mites, I don't have dust in my home. My house is very, very clean. Or if someone has a pet allergy, they say, I have a hypoallergenic cat or dog, I can't have these allergies. So the reality is that house dust mites are invisible to the human eye. They are present in the cleanest of cleanest homes because all they require is dead skin from a human being or fungus or mold that's in the environment and humidity, and they thrive and survive very, very well. So saying that a house does not have house dust mites is a myth. Same way there is nothing like a hypoallergenic cat or dog, because the allergens of the cat or dog are in their saliva and in their body secretions. Now tell me which dog or cat does not have saliva or body secretions? So that again is a complete myth. If we move to the next step and we've made a diagnosis, the next myth that I commonly hear is regarding medication. So a lot of people feel that if they take an antihistamine tablet or they are prescribed a nasal spray, that they will get addicted to these medicines. Now the definition of an addiction is that you lose control on yourself while taking that medicine. So you keep taking it all the time or take more and more of it to feel satisfied. It has an effect on your brain, it has harmful effect on your organs, and none of these definitions of addiction are true when it comes to anti-allergic prescription drugs that we are talking about. So this entire idea, because all of these drugs are approved by the US FDA, the European FDA, with 1-year trials or studies that are done to prove that they are safe on someone's heart, lungs, kidneys, brain, nervous system, you mention the part of the body, and only then they are given approval, because allergies are a chronic disease, especially nasal allergies can be year round, and a person may need to take medicines for longer. Now, one important caveat here is, if you see an allergy specialist and you get yourself allergy tested and you do the allergen avoidance and then something called allergen immunotherapy, then with immunotherapy you can actually desensitize or tolerize yourself from that allergen and not require these medicines. So that is the real way that ideally allergies should be managed. But if you have to take a medicine for a prolonged period of time, you won't get addicted to it. And finally, what I would say in terms of myths is the fact that some people feel that their anti-allergic medicines will stop working after some time. Okay, this is also not true. Studies have been done on this. As long as the person's allergic symptoms don't get worse due to an environmental change, a weather change, or some other what we call non-allergic trigger coming into the environment, like cigarette smoke, strong smells, other types of smoke from burning things, then the chance of requiring more medications or the chance of the medicine not working is really very, very low. So this whole idea that the medicines will stop working if we are on it for a long time is not true. Again, the answer here is to see an allergy specialist, get allergy skin testing, or where necessary a blood test done, and then go in for allergen immunotherapy, allergen avoidance, and the right pharmacotherapy under the guidance of an allergy specialist. If this is done, I truly believe that management of allergies is very, very safe. The medications are not dangerous or harmful, and you can really have a very good quality of life while being on this treatment with the right kind of care. So with that, friends, this is Dr. Sitesh Roy signing off. Take care, stay safe. God bless us all.